As the government presses on with the nationwide SHIF mass registration, a survey done by the Rural and Urban Private Hospitals Association, RUFA, reveals that many healthcare facilities are still struggling with delayed payments. The survey conducted in late December covered 243 healthcare facilities across 63 Social Health Authority branches.
But on the bigger picture was the fact that 58% of providers, all of them, didn't have any payment in their account. So we wanted to know why. Like we have public statements from the ministry, from SHA, that payments are happening. But when you ask hospitals, they say the payments are not happening. So we asked them a couple of questions. When was the last time you were paid, for instance? And for those who had never gotten a payment between October and December, 47% of them said the last time they saw any payment was September. So and remember we did the survey end of December. So we were looking at facilities who had been in a cash crunch for about 3 or even more months. So
96% of surveyed facilities reported financial distress, with private facilities being the hardest hit at 98%, followed by faith-based organizations at 90%. 81% of facilities are unable to pay suppliers, while 74% face essential supplies shortages. 6 out of 10 facilities are struggling to settle debts, with 32% at risk of auction.
Patients come under SHA. You can't see them because you can't call that doctor. It's like calling a mechanic who you still owe money from the last repair to come repair you now. And say, no, you are not serious. Please even pay the last debt before we attend to you. So in reality, even if SHA is paying regularly, or even if it was paying 5,000, the money is not enough to settle the liability or the hole in which hospitals are. And because of that, the hospitals are generating fewer and fewer claims. And because hospitals are generating fewer and fewer claims, SHA is paying them less and less money.
The Social Health Authority recently announced that it had disbursed 1.12 billion shillings to 5,000 healthcare facilities nationwide. However, hospitals are raising concerns about inconsistent payments. In October last year, only 19% of facilities received payments, while 81% remained unpaid. The situation improved marginally in November, with 23% of the hospitals paid, but by December, 80% of the facilities were still waiting for their funds.
We asked specifically those who had been paid. So we said, if you have been paid, how many times have you been paid? So those ones said, 58% of them said once, 36% said 2 times, and only 6% said 3 times. So which showed that the regularity of payments is also a concern.
In early 2024, under the leadership of the then Health Cabinet Secretary, Susan Akumicha, a 10-member committee was tasked with identifying assets and liabilities of the now-defunct NHIF. However, nearly a year later, the report is yet to be published, leaving affected healthcare facilities in limbo.
The report. This is a public report. It should be made public. Because as we all know, that the money that was in NHIF, the money in NHIF was not anybody's personal, was not government's money, it was people's personal money. So if my personal money was used to buy land, please show me. If my personal money was used to buy bonds, I want to know. Because the money that was in NHIF was contributors' money. So that report that was made by the Transition Committee on Assets, Liabilities and Obligations of NHIF, including the number of staff who are employed by NHIF.
Eunice Omolo, K24 TV.